Joint health is one of the most important aspects of overall well-being, yet it is often overlooked until problems begin to show up. Healthy joints allow us to move freely, stay active, and enjoy life without pain. But when joints become stiff, painful, or inflamed, even simple activities like climbing stairs or walking to the store can feel like a challenge. The good news is that nutrition plays a powerful role in keeping joints healthy and strong. Vitamins, in particular, are essential because they support cartilage, protect bones, reduce inflammation, and help the body repair damage. In this video, we are going to explore the most important vitamins that support joint health, backed by science and practical examples. You will also learn how to include these vitamins in your diet naturally, without depending only on supplements. First, vitamin D, the foundation of strong bones and joints. Vitamin D is often called the sunshine vitamin because our skin produces it when exposed to sunlight, but its role goes far beyond bone health. It helps the body absorb calcium and phosphorus, two minerals essential for strong bones and cartilage. Without enough vitamin D, bones become weak, fragile, and more prone to fractures, which in turn puts extra stress on joints. Research has shown that people with low vitamin D levels are more likely to experience joint pain, especially in conditions like osteoarthritis and rheumatoid arthritis. This is because vitamin D deficiency weakens the surrounding structures and increases inflammation. For example, one study in the journal Arthritis and Rheumatism found that people with adequate vitamin D had slower progression of osteoarthritis compared to those with low levels. That means vitamin D does not just protect joints, but may also help slow down damage once it has already begun. How can you get vitamin D? Naturally, spending 15 to 20 minutes in the sun a few times per week is a simple way. But diet also matters. Fatty fish like salmon, mackerel, and sardines are excellent sources. Egg yolks, fortified milk, and mushrooms exposed to sunlight also provide vitamin D. In colder climates or in people who do not get enough sun, vitamin D supplements may be recommended by doctors. Second, vitamin C, essential for collagen production. When we think of vitamin C, most people immediately picture oranges and immunity. But vitamin C is also critical for joint health because it is needed to produce collagen. Collagen is the protein that forms the structure of cartilage, tendons, ligaments, and even skin. Without enough collagen, joints lose their cushioning and become more vulnerable to wear and tear. Studies have shown that vitamin C not only helps prevent joint problems, but also supports healing after injury. In fact, people who consume enough vitamin C have a lower risk of developing inflammatory conditions like arthritis. Vitamin C is also a powerful antioxidant, meaning it helps neutralize free radicals that cause inflammation and joint damage. That is why diets rich in vitamin C are linked with less stiffness and pain. Good sources of vitamin C include citrus fruits, strawberries, bell peppers, broccoli, kiwi, and tomatoes. For example, just 1 cup of chopped red bell pepper contains more vitamin C than an entire orange. Adding raw vegetables and fruits to your meals is an easy way to boost collagen production naturally. Third, vitamin E, the antioxidant shield. Vitamin E is known for protecting skin from aging, but it also plays a key role in joint health. This vitamin acts as a fat-soluble antioxidant, reducing oxidative stress in the body. When joints are inflamed, free radicals can attack cartilage cells, leading to faster deterioration. Vitamin E helps block this process and protects tissues. Some studies have even shown that vitamin E supplementation can reduce pain and stiffness in people with osteoarthritis. Its anti-inflammatory effects make it especially useful for long-term joint protection. Nuts, seeds, and vegetable oils are rich in vitamin E. Almonds, sunflower seeds, and hazelnuts are excellent choices. Green leafy vegetables like spinach also contribute. Vitamin E works best when consumed regularly through whole foods, rather than relying only on pills. Fourth, vitamin K. The bone and cartilage protector vitamin K is less famous than vitamins D and C, but it is equally important for joint health. Its main role is to activate proteins that bind calcium to bones. Without vitamin K, calcium may not be properly absorbed, which weakens both bones and cartilage. A study published in the American Journal of Clinical Nutrition found that low vitamin K intake was associated with greater risk of developing knee osteoarthritis. This shows how essential it is for maintaining long-term joint strength. Foods rich in vitamin K include green leafy vegetables such as kale, spinach, and collard greens. Broccoli, Brussels sprouts, and fermented foods like natto also provide high amounts. Regular consumption of these foods not only strengthens bones but also improves overall mobility. Fifth, vitamin B complex, energy and nerve support for joints. The B vitamins, especially B6, B9, folate, and B12, play an indirect but crucial role in joint health. They help regulate homocysteine levels in the blood. High homocysteine has been linked to inflammation and cartilage damage. In addition, B vitamins support energy metabolism and nerve health, which reduces pain perception. For example, vitamin B12 deficiency can cause nerve problems that mimic or worsen joint pain. Folate and B6 deficiencies are also associated with increased inflammation. Sources of B vitamins include whole grains, eggs, poultry, meat, legumes, and leafy greens. People who follow strict vegetarian or vegan diets may need supplements, particularly for vitamin B12, since it is found mainly in animal products. Sixth, vitamin A, supporting tissue repair. Vitamin A is essential for cell growth and repair, which means it helps damaged cartilage heal more effectively. It also acts as an antioxidant, protecting tissues from inflammation. However, balance is key. Too much vitamin A, especially from supplements, can actually harm bones, leading to weakness. The safest way to get vitamin A is from food sources like carrots, sweet potatoes, pumpkins, and dark leafy greens. These foods contain beta-carotene, which the body converts into vitamin A as needed, preventing toxicity. Seventh, vitamin F, omega-3 fatty acids. Often called essential fats, although technically not a vitamin, omega-3 fatty acids are often grouped with essential nutrients for joint health. They have strong anti-inflammatory properties, reducing swelling, stiffness, and pain in conditions like rheumatoid arthritis. They also support the production of joint lubricating fluids, keeping movement smooth. Sources of omega-3 include fatty fish like salmon and sardines, flax seeds, chia seeds, walnuts, and fish oil supplements. Regular intake has been shown to reduce dependence on pain medications in arthritis patients. Conclusion: joint health is not just about avoiding injury or exercise. It is deeply connected to nutrition. The vitamins we discussed today, vitamin D, vitamin C, vitamin E, vitamin K, vitamin B complex, vitamin A, and essential fatty acids, all work together to strengthen bones, reduce inflammation, support cartilage, and protect joints from long-term damage. By including more colorful fruits, vegetables, whole grains, nuts, seeds, and healthy fats into your daily diet, you can give your joints the support they need. Simple lifestyle changes like spending time in the sun, eating more leafy greens, adding berries and nuts to snacks, or including fish in your meals can make a noticeable difference over time. Remember, supplements can be helpful, especially when deficiencies are present, but food should always be your first source of nutrients. A balanced diet rich in these vitamins will not only support joint health, but also improve overall immunity, energy, and longevity. If you found this video helpful, give it a thumbs up and share it with someone who struggles with joint pain. Do not forget to subscribe to the channel and hit the notification bell so you never miss science-based health tips. Take small steps today toward better nutrition, and your joints will thank you tomorrow.